Hello, I am Dr. Sujay Dasgupta, consultant gynecologist and infertility and IVF specialist. Many times we see that men who are suffering from infertility, they are coming to our clinic with a report of ultrasound scrotum which shows the varicocele, and they ask doctor whether I should go for operation for the varicocele or not. Before that, you have to understand what is meant by varicocele. Varicocele is the dilatation or swelling of the veins lying above the testicles. But remember, whether you have varicocele or not, it can only be diagnosed clinically. That is, by examining you in doctor's chamber, where doctor will ask you to stand and doctor will see your testicles, and sometimes doctor will feel the testicles and will ask you to cough. If ultrasound is done to detect varicocele, that may not be important varicocele. Why? If you don't have varicocele, seen clinically, that is, if doctor fails to detect varicocele but your ultrasound report is showing varicocele, that is something called subclinical varicocele, and it should not be treated, because if you treat subclinical varicocele, you are doing more harm than good. But only if there is grade 3 varicocele, that is severe varicocele, which can be seen from a distance when you ask you to stand and ask you to cough. In that case, that varicocele can be treated, provided that this varicocele is causing sperm problems and you are having small testicle or some pain in the varicocele, and most importantly, your wife's reports are normal, that is, there is good chance that you can conceive naturally if varicocele is treated and sperm count improves. But remember, nowadays we are no longer advising open operation for varicocele. What we are advising nowadays is embolization, that is, small needle is inserted by the radiologist inside the veins, and these veins are destroyed so that your varicocele can improve and you have better sperm count to help you to conceive naturally. Therefore, if your ultrasound report suggests varicocele but we don't find varicocele when we examine you clinically, that does not require any treatment. Therefore, whether you have varicocele or not cannot be detected by ultrasound. It can be detected only when you undergo physical examination in the doctor's clinic. Thank you for watching this video. If you have further queries, please don't hesitate to contact us through our Facebook page or YouTube channel.